Hi, good evening. So if anyone has a question, you can unmute yourself. The mute button, unmute button is the microphone symbol. If you click on it, it will get unmuted. Uh, so I know Dolores was here before. Dolores, if you want to go first, you can. And I think that how do I say name correctly?
My name is
Julia
Giuliano.
Giuliano. Oh, great.
Yeah,
Dolores,
nice to meet you.
I see that you're not unmuting, so I'm going to go with Giuliano. I think he may have a question.
Yeah, I just wanted to come on here. Nice to meet you. I saw some of
Pleasure
your
meeting
video.
you. Oh,
Um,
great.
yeah, and I saw someone in another group in this school group, so I joined. But yeah, so I think you might have seen my post, but I
I'm
was
looking at it
prescribed.
right now.
Oh, thank you. Yeah, I really appreciate your responses to it. Yeah, I got prescribed LDN because I've had long COVID, chronic fatigue
Mhm,
since
mhm,
October 2025. And I was at a 40% functionality score, I'd
mhm,
say,
mhm,
before LDN. I
mhm,
was slowly going out. I was able to drive more, going out with friends a little bit. And then I started taking LDN, and
mhm.
then I got to about a 20% functionality score. I started getting really tired and
Yeah,
and just weak. And then so I went off of it. I saw your video about
yeah.
7-day reset, going on ultra low dose, and I was like, okay, cool. But I'm on day 6 of my break, um, and it's like I feel even like 10% now of functionality. I just feel
Mhm,
even worse when I was on LDN, but then even worse than before I started LDN. So I guess wanted to say that and see
mhm.
what you thought. I guess.
I don't know. I mean, you'll have to discuss it with your doctor, but if something like that
Yeah.
happens with my patient, I just tell them stop the LDN. If it was due to LDN, then if you go out like 7 days, 14 days, 3 weeks, a month, theoretically, it should go back to normal because the LDN half life is about 4 hours to 6 hours, but then it turns into metabolite, and the metabolite has probably longer half life. But if you took it for this long, then it should be out of your system. And the question is it possible that because some people say, okay, I don't think LDN is helping. I think I'm getting some side effects, and they quit, and then they go, oh my god, I think LDN was helping me before. I just didn't know it. So if that's the case, I would say that, and I would talk to your doctor. And if anyone had issues, I always like to start really low dose. And the low dose or ultra low dose to me is 1 microgram. And because I think that people don't understand the level of suffering people go through with long COVID, because long COVID actually is not an easy condition. It's I've had patients with who are healthcare professionals, and they have to get back to work, otherwise they can't make a living. And so even those people who are highly motivated to do everything I say to do, they're about 70% better, meaning that they can work about 3 days a week, but no more than that. So I think that it's the COVID, long COVID is really not an easy condition. It's a very difficult condition.
Yeah, thank you. I really like your approach to ultra low dose. I think that's the safest way to do it, especially for people with long COVID. So I tried discussing with my provider, and they're not sure if they can get it compounded that
Where are
low.
you? Where are you?
I live in Arizona.
So just ask them to call into like Harvard Compounding Pharmacy in Santa Ana, California. Santa
Oh,
Ana, they're able to do it. So just tell
oh,
them Harvard Compounding Pharmacy, Santa Ana, California, or Belmar can make up to 2 micrograms. And
oh,
first, I think there's a place called First Care, like specialty compounding pharmacy in Mount Laurel, New Jersey, and they are also able to do it. There are a lot of places that can do 1 microgram. If they don't know, it's just because they're not used to using the ultra low dose naltrexone, just because. And then I'll just research and um, compounding pharmacies. They may not be as happy to share with name of competitor, but if they can't do it, I don't think it's competitor. It's they don't do it. So um, it would be really nice if they could. So
yeah. Thanks a lot. I'll look into that.
Thank you. Thank you.
Thank you.
Dolores, do you have a question?
Actually, first, Giuliano, where in Arizona are you?
I live in the Phoenix area.
Okay, because I'm in Tucson, and
Oh,
I get
wow.
I get mine from prescription lab compounding pharmacy here in Tucson.
Oh, okay.
So
Wow. Good to know.
Yeah.
I think that they ship if you want to look them up.
Thank you.
And
Well,
I would be shocked if there's not a compounding pharmacy in Phoenix that can't do 1 microgram. If Tucson has it, I spent 2 years in Tucson working with Dr. Andrew Weil in University Health Center. Of course, now Banner took over.
yeah.
Prescription lab compounding pharmacy might be able to tell you who's in Phoenix too if you called them.
Okay.
They're on East Grant Road here in Tucson, and my doctor's name is Dr. Brian Cabin.
Sorry.
Yeah.
Yeah.
So just in case you want to look those up.
That's
Yeah.
That's what a coincidence. Thank you so much. I'll look
Yeah.
into that. Let me write this
Yeah.
down. Thank
Yeah, but there should be plenty of people. When I first got started, it was really challenging, but now I think there's a lot more places that are willing to do it. And then the one clue is ask them if they get it assayed, because it's one thing for them to say, "Oh, we do microdose naltrexone," and then you ask them, like, "Do you have it checked? Do you have it sent to the lab?" They're like, no." It's like, how do you know then? Like, they don't know. Yeah.
If you
Okay,
find a
Juliana.
compound box, if you find one there in Phoenix somewhere, call them and ask them for a doctor referral if that's what you need.
Thank you. Yeah, I've been having some. I'm not sure if I trust my provider as much in terms of LDN and some other medicines. So I could definitely ask about
Yeah,
that. But thank you.
that sounds good. Okay, Dolores, do you have a question for me?
Well, last time we talked, I mentioned that I was having issues with the LDN. I was on 4 milligrams. I had worked up to that, and I never really felt really well on it, and I just kept getting worse. So you had mentioned you were talking about stopping for like 7 days. So I stopped for 6
I mean,
days. I was
that's I can't give you medical advice. So it sounds like you have a
right.
great doctor you're
You
working
had
with. So
suggested,
yeah, in
yeah,
my
you had
practice,
suggested,
that's what I do. In my practice, that's
yeah.
what I do. But as
I
to what you want to do, you should discuss with your doctor what he or she thinks.
I saw him the other day and was talking to him, and I gave him your information too, because he's learning as well. He likes to hear from me and my experience. So, but
I'm
yeah, I did
currently
not.
writing a book for clinicians specifically, so that they can
Oh, great!
that they would not. I mean, if they are motivated, that they would have a resource. And I know they're busy, so it'll be like a 10 chapter a primer for clinicians, not, but it'll be a lot more in depth.
I printed off some information that you had
Mhm.
online to give to him,
That's
um,
great.
and he was thankful for it. But yeah, I went 6 days, and last night I took, I think, point oh 0.05 or point five was it? And I didn't sleep very well. I did it during the night, my first time when I woke up. So I'm thinking tonight I diluted mine down more so that I could try maybe 0.025, I think is what I diluted it to, that I could take like a drop or two of.
So,
So I'm
what
going
is
to
your
try
question, Dolores?
that. Well, I guess I don't really have. Oh, I no, I do have a question. Um, I found out that my cortisol levels are pretty much tanked during the day, and I
Mhm.
was wondering if LDN has an direct effect on cortisol.
So, not that I know of. The But it is a complex topic. Because endorphins, there's not anything endorphin doesn't touch. Endorphin touches on serotonin. It's endorphin is between serotonin and uh, you know serotonin and dopamine, and so but it's not. It doesn't talk to dopamine. It doesn't talk to serotonin. But I know that it says that if you take regular dose naltrexone, then actually it increases cortisol in about 60 minutes to 150 minutes, which means that, but LDN there's not a strong evidence it does it, but it's also possible if you're endorphin depleted that even 5 milligrams can increase cortisol. But you says yours tanks. So I'm not sure. And some people says that that cortisol effect of LDN or naltrexone on cortisol.
I think we lost you.
I'm not.
There you are. Whoop. You're cutting out. You're frozen. We can't hear you. I see you.
And if another person
Still can't hear anything.
There's motion.
See you again.